WZTS-LD 16 Hinton, Cozy TV.
Doc Talk with Dr. Paul Conley is a production of TTV, which is solely responsible for the content.
Hello, welcome to Doc Talk. I'm Dr. Paul Conley, and tonight we're going to be talking about rhinosinusitis. A lot of people know this as sinuses, and sinusitis is something that we think about quite often. In fact, it's so common that in the United States of America, there's approximately 37 million adult Americans that will suffer with rhinosinusitis. We think about this annually, 1 in 8 adults will suffer from this, which equates to 18 million office visits or visits to a healthcare facility, which equates to $5.8 billion, with a B, $5.8 billion in healthcare costs. Tonight, our guest is Dr. Andrew Petersen. Dr. Petersen is an ear, nose, and throat specialist, otherwise known as an ENT. And Dr. Petersen is going to talk to us about, hey, I have sinus problems.
Thanks for having me on.
You know, Dr. Petersen, I didn't mean to cut you off, but, I know all the time, I see you at the hospital and you're talking about individuals with sinuses and sinus problems, and sometimes these people end up in the hospital and require surgical intervention, but most of the time that's not the case. And I think that I'd like for you to walk us through about sinuses, and I think, it's kind of this broad term. I know as a kid growing up in West Virginia, you always hear, oh, it's my sinuses acting up, and that can be anywhere from a runny nose to a headache to watery eyes. Oh, I got the hay fever. But there's definitely basically specifics that I want you to talk about when we talk about, hey, I've got sinuses, doc.
Sure, yep. Well, like I said, thanks for having me on. This is one of my favorite topics. I can talk about it for hours and days. We do talk about it all day long here in the office, both with patients, teaching them, as well as teaching students, and so it's easy stuff to discuss. Your statement there of I have sinuses, doc. I mean, that's kind of a common entry complaint that a patient would have, and it comes in other forms. I have sinus problems. I've had sinus problems my whole life. And it is a little bit vague and a little bit broad, like what does that mean? Patients sometimes don't know exactly what that means. I think providers, physicians don't always know exactly what that means. It's my job, or our job as the ENT clinic, the ENT team, to kind of decipher through those complaints, get into the exactly what are your symptoms, what's bothering you, turn that into a treatable condition that then we can hopefully help you feel better, whether that's medically or sometimes surgically.
So I think, not all sinus, rhinitis, runny nose is basically created equal from what you're saying. So what are some of the complaints that people present to you here in the clinic that, I'm here to see Dr. Petersen because I have sinuses. So what exactly complaints are these people usually talking about?
I kind of break it all down into, 3 broad topics. And I guess before I even explain that, let's just a real fast anatomy assignment so folks know what it is that I'm talking about when I use some of these terms. So we think about the nasal cavity. That's inside the nose. That's your septum, your turbinates. That's just the nose itself. And then when we say the word sinuses, we're referring to the paranasal sinuses. Those are air-filled cavities that drain into your nose via a tiny pathway. And those include your cheek or your maxillary sinus, your ethmoid sinuses between your eyes, your frontal sinuses up in your forehead, and then there's one in the back called the sphenoid. And so just broadly to think of the nasal cavity itself and then the sinuses that drain into that. So as far as, the 3 main topics, that I often try to simplify this into. Number 1, there's a problem with the nasal cavity, or rhinitis, and that's the lining of the nose, swelling, drainage, allergies being a common example of that. Number 2 would be it's a sinus problem, that you have inflammation, swelling, infection, polyps, some problem that's happening in the sinus cavities themselves. And then number 3 is just nasal airway obstruction. that you can't breathe. You're not moving air through your nose for some anatomic reason, such as a deviated septum. There's an area called the nasal valve that can get narrowed. And again, it's just a moving air problem. All three of those can walk in the door with a statement of, my sinuses don't work well. I have sinus problems. And so we got to decipher through and pick which one of those it is. It can be a combination of them.
Because from what you're saying, a lot of the complaints that I think is out in the community, springtime, it's more of an allergic rhinitis. It really doesn't involve the sinuses. Maybe just for the viewing audience, what is the purpose of a sinus anyway? Why do we have these fluid filled? What is the purpose of us having sinuses, and what do they do?
It's a great question, and maybe even a hard question to tackle here on our show. There's a few different theories of why they exist. One is that it's involved with the health of the nasal cavity itself. And there's some air pressures and air concentrations, nitrogen versus other, that are involved with that. Number two, it's thought to be part of what gives us our voice quality. So it gives us our resonance in our voice. If I pinch off my nose, my voice changes. If I let it go, it goes right back to normal. So your sinuses give you your voice quality, which is how we interact as humans. And then number three, they're kind of thought of as protective to the brain. If you took a trauma to the face, the sinuses are meant to take the damage to protect the vital structures, the brain.
I always kind of thought, because I have a big head, I always thought maybe it just makes my skull lighter. We kind of carve out the bone, because I thought if I just had a solid, it'd be like carrying a bowling ball around. So that, well, I'm glad you brought that up, because yeah, I guess I'd rather smash my sinus than smash my brain.
It's a gruesome thought, but a lot of theories as to why they exist.
Well, because you kind of wonder, because they can be problematic, and that's why we're talking about the show. So it's kind of like what's the purpose of sinus? But you explained all that there's definitely a reason that we have sinuses, and in saying that there are issues. So I know you kind of talked about the chronic rhinitis, that's the nose, sinusitis, and nasal obstruction, because I just know that I've had patients to me, they'll complain, they'll say, hey, listen, I went and I saw this provider, maybe it's an urgent care, maybe it's a primary care provider, and I needed an antibiotic and I didn't get an antibiotic. They must not know what they're doing. Why did I not get an antibiotic? So in today's when we talk about antibiotic stewardship, where we're really trying to make sure that we only prescribe antibiotics when there's infection, maybe you can talk about the difference between that rhinitis, infectious sinusitis, and then the nasal obstruction.
Yeah, so it's a great question, and it really gets into just different treatments for different problems. And I'm always using this phrase, to be the best physician, the best surgeon, and get outcomes for patient, I got to be the best clinician. I got to get the problem right before I can start working on the solution. Antibiotics fix infections, specifically bacterial infections. And so if you have a bacterial infection, it's a great treatment. If you have a bacterial sinusitis, it's a great treatment. If you have rhinitis with an allergic runny nose, it's not going to do anything. If you have a deviated septum and you can't breathe, those antibiotics aren't going to do anything. And so each of these kind of broad categories, I lump them together because their treatments they kind of lump together. Again, topical treatments for the nose, for rhinitis, antibiotics, potentially sinus surgeries for sinus problems. And then as far as nasal airway obstruction goes, it's trying to address the mucosa, get it healthy, but there might be an anatomic problem, back to the deviated septum. If that's the root problem, that's generally a surgical solution to straighten that out.
So let's go each one. So chronic rhinitis, that is, what are typically the symptoms of chronic rhinitis?
Swelling of the mucosa and drainage. And an important one to think of with that's worth mentioning are just irritant exposures that we see through life, but also through occupational exposures. The best example I use are coal miners. I have many coal miner patients, and they all come in, they're breathing coal dust all day long. They're not allergic to coal dust, but that irritates the nose. If anyone sat around all day and breathed coal dust, it would irritate their nose, start drainage, start swelling. you need to clean that out, flush it out with some saltwater sprays, maybe use some steroid sprays to help decrease that. And that is a rhinitis problem right there.
So that, again, that's not infectious. And so
Correct.
You're saying that's more of an allergic reaction in the nose, and then that's when we're talking about things that would decrease that inflammatory response, and that's maybe where we talk about the topical nose sprays, maybe antihistamines, things like that.
Correct.
So then we talk about sinusitis, not rhinitis, but the sinuses themselves. Now they're inflamed. So we got the itis of the sinuses, and then that's about infections and things like that. So maybe describe what that patient would present with and how do we treat that?
Yep, great. So there's kind of the 4 classic symptoms of sinusitis: facial pain and pressure, thick, purulent nasal drainage, increased nasal congestion, hyposmia, which is loss of sense of smell. So those 4 symptoms are the classic sinusitis symptoms. Sinusitis kind of comes in 2 forms: infectious origin or just chronic inflammatory. Not all sinusitis has to be due to an infection. It might have started as an infection, but it's progressed into this chronic inflammatory state. So, treatments there include, again, back to treating the nose well, sprays, etc., but also maybe it deserves a surgery or a simple procedure even to open the sinus, promoting good airflow in and out of the sinus so you're not getting facial pain and pressure all the time, less susceptible to those sinus infections.
So that individual with the possible being infectious, they're going to have more pain, I would suspect, than the rhinitis. They're going to have maybe even low-grade temp, maybe a fever, or maybe the seasonal allergy, drippy, runny nose patient, maybe not.
Correct, yep.
And then as far as if it's viral, obviously we don't use antibiotics. Bacterial you do. And do you ever just use watchful waiting? I mean, and again, with this sinusitis, that's, the swelling, the tenderness, do we always use antibiotics? Do we not? Do you watchful wait? When do you determine that a patient would benefit from antibiotics?
Yep, that's a great question as well. Watchful waiting is appropriate in a lot of times, given that 98% of sinus infections are viral in nature. Let's say 90%. Let's back it down a bit. 90% of infections are viral. So just symptomatic treatment, you don't need an antibiotic. The 2 distinguishers where you should consider an antibiotic is if the duration of symptoms have lasted beyond 10 days. And then number 2 is something called the double worsening effect. That's where you have symptoms, they start getting better, and then they rebound much worse anywhere within that timeline. Those are both indications this might have turned bacterial.
Because most, bacterial infections persist, but viral, that's the 10 days, right? That's typically when we think about viruses, usually they run their course, and after 10 days of the viral, then you should be improvement.
And let me make one other comment there. It's an area where I get the benefit of all the amazing tools that we have in an ENT office, and that includes nasal endoscopy, rigid endoscopy cameras to look into the nose. So there's times where it's a tough question. It's tough to decide. I get the benefit of spray your nose, as I think we're going to do later today, and look in with a camera so I can literally look up to the opening of that sinus and see, does it look perfect, like normal mucosa, or is there purulence and is there infection pouring out of that?
Well, it looks like you timed it right. We're right up against the commercial break, and that's exactly what we're going to do. We are going to actually take a break. When we come back, Dr. Petersen is actually going to do an exam on my nose, sinuses, look for the possible obstruction, deviated septum, all the things you just described, and you're going to see that right here in Doc Talk. So we're going to take a commercial break. Stay tuned, and we're going to be right back.
WZTS 16 Hinton Cozy TV is your local television station, serving southern and central West Virginia with classic shows and original local programming. Whether you're watching comfy classics you know and love, or content created right here by local voices, WZTS delivers programming you can rely on every day. Learn more about our station, programming, and coverage areas at WZTS.tv. You're watching Doc Talk with Dr. Paul Conley on WZTS 16 Cozy TV. Stay with us. We'll be right back after these messages.
Vandalia Health is proud to be a West Virginia-owned healthcare system, bringing together the hospitals and providers of CAMC, Mon, and Davis. We are dedicated to enhancing the health of our communities through clinical excellence. Our compassion and commitment remain the same with people you know and trust to care for you and your families. With more specialists, hospitals, and outpatient locations, we are delivering expertise and state-of-the-art care. Vandalia Health, expert care close to home.
Welcome back. Doc Talk with Dr. Paul Conley continues on WZTS 16 Cozy TV.
Hello, I'm Dr. Paul Conley, and thanks for coming back to Doc Talk. So, as you saw right before the commercial break, we talked a little bit with Dr. Andrew Petersen. We're here in Fayetteville in his clinic, and we talked a bit about rhinosinusitis. So he really walked us through the difference between rhinitis, like that seasonal allergies, just clear runny nose, watery eyes, versus the actual infection of the sinus cavities themselves. And we talked about the pressure and where and when one would benefit from antibiotics and when watchful waiting would be basically the best treatment. So one thing that Dr. Petersen does here in the office, this is an office-based procedure, he's actually going to walk us through an exam of the sinuses, of the nasal cavity, and then that's how Dr. Petersen, as an ear, nose, and throat specialist, is able to differentiate between these three: an obstructive pattern, an allergic type of pattern, or maybe an infectious pattern.
Yep, sounds good. So yes, we do this exam all day, every day. Rigid camera, I'm going to start getting things set up. I'm going to spray your nose first with a little bit of Afrin, which helps to kind of decongest and open the nose up. So hopefully we can see a little bit easier and better. And I'm going to start doing that. While I'm doing it, I'm going to ask you, do you have any nasal symptoms? And I want you to be honest. Do you have any nasal symptoms that are constant or even intermittent in nature? And maybe we can look and see if we can find any clues on what might be causing any of that.
Well, so I just want to ask you a real quick question. I'm glad you brought up Afrin, Dr. Petersen, because I know, right? That's I'm sure people watching this show, they're like, man, Afrin, he said Afrin. I mean, see, honey, I use Afrin all the time. Tell me about that. Tell me about chronic Afrin. I know that maybe is a topic, bone of contention there, but
yep,
what's your recommendation for Afrin nasal spray? It's over the counter. I can tell you my dad lived on Afrin nasal spray forever and ever until he finally saw an ENT and said, you need to cut that out.
It's a nice little sidebar. So Afrin is a strong decongestant. It opens up the nose really well. It's very potent. It works really well in any given single moment. This bottle is nothing but Afrin, and I'm going to spray it in your nose to open things up. It does have the unfortunate side effect, if you use it daily and consistently, in a few short days, 3, 4, 5 days, you start to develop this item called rebound congestion, where then when you stop using it, you get congested, you can't breathe, and you need to spray more of it. So it's one of these ones, you don't need to be scared of it any given single moment. This is safe to use right now, but it's definitely not something to use on a daily, consistent basis.
So you just said basically no more than what, a few days?
Three days in a row.
So if you got a cold, you got a virus, cold's going around, and you just can't breathe at night.
That's for you.
All you.
I'm going to spray this Afrin in your nose.
Then you would say no more than a few days.
Yes. You don't need to do anything. All right, little sniff in through your nose. If you need to dab your nose, you can. Don't blow your nose though, but just kind of sniff that in. Let's let that work.
Well, you did ask me about some symptoms. It does seem like
Keep talking though.
that I do have, which it seems like a lot of people have, like, when I first wake up in the morning, Dr. Petersen, I will sometimes when, first wake up, I just have some congestion, and maybe I just need to blow my nose like one time, and after I do that, I'm clear. So what does that sound like to you? Just kind of that first morning, I got some nasal congestion, but then as the day goes on, it usually goes away.
It could be just a stasis issue where you've just kind of collected some mucus from not breathing, moving air as well through the night. I'd say the more common thing would be that your turbinates have swelled a little bit. Turbinates are the humidifiers for the air we breathe. They swell up and shrink down all day long. When you get allergy reaction or you get a cold and you just can't breathe through your nose, it's the turbinates swelling up. They are very dynamic, reactive structures, and so when we sleep all night, we lay flat, gravity's not helping us, they swell up. and they move into their phase of action of rest and digest, parasympathetic tone. They swell up, create some drainage. So it's kind of common to wake up with a little congestion just from some mild turbinate hypertrophy. That is normal to some degree. If it's excessive, causing big symptom, then it's a problem, and you can address it a handful of ways.
No, I just think it's that morning, you kind of got the sleepy eyes kind of a thing. You're waking up, it's 5:30 in the morning, you get up coming to work, and then you kind of blow your nose once and, get a hot shower, and then it seems like you got a little congestion, and it kind of breaks up in the hot shower, and then I'm good for the day.
Yep. Okay. Rigid nasal endoscopy. We've got a camera here, 3mm camera. This has a 30-degree lens at the end. We're going to use it to look into your nose. So you can kind of lean back. There's a headrest there. Okay. Great, just like that. You breathe through your nose or your mouth, whatever's most comfortable for you. I'm going to take a peek. If anything hurts, let me know. I'm going to turn you just towards me a bit. There you go. So if anything bothers you, let me know, but I doubt that it will. So I'm just kind of getting a glimpse of things right off the bat from the front. We've got the septum on the left side of the screen, turbinate on the right. As we come back, we can see your septum does deviate to your left a bit. I would love to be able to look up here and see your middle turbinate. There it is up high, but it is not that easy to see into the left side of your nose. If we go back to that septum, look, there's kind of like a fin or a spur, as we would call it, that juts over to your left. And so your left side of your nose is just your naturally more narrow side. As we look on the right, I'm going to expect that it's a little more open. Let's do that. Yeah, so similar. So when I'm in here, now we've got the septum on the right side of the screen, turbinate on the left, and right off the bat, I can see that middle turbinate way up high. It is high, but I can see it much easier. You can see on your septum, there's even like a little indent. That's where it is indented on your right as it spurs and deviates over to your left. So it's kind of, you're seeing the opposite side of the deviation there. Let's see if we can get a little bit higher. Right up here. So now we're looking at the middle turbinate, and I'm looking under that structure. That's where the opening to your maxillary sinus and multiple other sinuses drains in. So if we were going to see an active infection, it would be right there. And I don't. It's nice, normal looking mucosa. I know it's a little bit tight getting up in those corners. On your right side, I can get up there. On your left side, to do that same move and get up high to look under that middle turbinate, it would be difficult and maybe uncomfortable for you because it's physically a smaller, narrow space because of your slightly deviated septum. I don't see any polyps. That's a topic we haven't spoke a lot about. That's always a good thing. Polyps are a problem. They're a form of chronic sinusitis, where you have chronic sinusitis with nasal polyps. I'm going to put the camera down here.
So what causes a deviated septum? Is that just natural for many people? I mean, I know we talk about trauma. I mean, is that something that you see commonly, a deviation of the septum?
Yeah, so they're common. They can occur for multiple ways and reasons. It might just be the way your nose is made. They're often related to some degree of a trauma event. It could be a childhood minor trauma that you didn't pay much attention to at a young age. It can be a bigger trauma event. The classics are fights, car wrecks, and sports. You know, that accounts for a lot of the nasal work that we do. A lot of deviated septums are asymptomatic. I don't think that you have a tremendous amount of complaint from your breathing, from your septum. You probably don't need a septoplasty. But there are a lot of people that are quite symptomatic from it. So not all deviated septums need intervention necessarily. The topic of nasal airway obstruction is one of my favorite. It applies to assessing the nose from a structural mindset. Septum, the side walls, do they collapse? What's the strength and integrity of the cartilage of your nose? Does it naturally hold itself open, or does it collapse with every breath in? And that often leads to surgical interventions if it is a problem. And they are, in my practice, very common surgeries that we do. I think there are a lot of my patients that are quite happy. They're fun cases for me, both from initial visit to the surgery itself, because each one is unique, each one has its own challenges, and patients are generally quite happy because it's an anatomic problem. Here's a problem that's anatomic, you fix it, symptoms resolve. It's very direct in that way, and so I enjoy that type of work.
So when you talk about nasal polyps, that can cause the rhinosinusitis. In what way? What does the polyp have to do that's causing the rhinosinusitis?
Yeah, it's another good question because it's its own entire topic that we haven't spent a ton of time on today. I've been to endless hours-long lectures on nasal polyps and all the nuance between them. Nasal polyps are a form of, it's a swelling, it's a growth in the nose, generally associated with chronic inflammation, sometimes allergy-related, but not always. Chronic inflammation, and you get these watery-filled growths, polyps in the nose. Different than a colon polyp, different from polyps elsewhere in the body, but a polyp as a benign term like that. And what do? They physically block the nose. So they block the openings to the sinuses, you get sinus infections. They block the nasal cavity itself, you can't breathe. They block the roof of the nose, you can't smell. And they deserve a lot of special attention. Surgeries are useful for them. Good medical management is completely necessary after your surgeries. Polyps have a tendency to come back. So they're long-term, often lifelong patients where we got to control them once and we got to keep them from coming back.
So since you talked a little bit about maintenance as we're getting ready to wrap the show up, I know a lot of people in West Virginia suffer from seasonal allergies, and then they have that rhinitis. As an ear, nose, and throat specialist, what would be a take-home point here for, you just said afronasal spray, that's basically going to be for an acute type of condition, 3 days, no more. That's because you got a common cold or another type of viral infection. But for that person that suffers miserably with the water eyes and rhinitis, what's the take-home point? How do you go about treating those folks?
The quick and easy are your nasal steroid sprays, your Flonase. Everyone knows that term. It's widely available. It's cheap. It's easy. I personally get spring allergies. Luckily, I don't get a lot of allergies in other seasons. And so every year, and we're coming up on it now, I start doing Flonase nasal spray every day, usually in March, April, and I'll carry it through June or July, and I use that as my daily maintenance nasal steroid spray to keep back my allergy type symptoms.
Because you're topically putting the medicine where it needs
Correct.
to go.
2 sprays both sides once a day. It comes in a lot of, there's other brands, other names, other ones out there where we don't favor Flonase over others. It's just the common name folks know, that's the quick and easy. I could explain that question. I could answer that question in much more depth, but that's the quick and easy.
One other quick thing, and I know we talk about this for so many other health issues, smoking. What does smoking, how does that play a role in folks that have chronic rhinosinusitis?
It makes the lining of the nose, the mucosa, not work well. The body's an amazing thing. It's trying to clean, self-fix, self-remedy all of its problems. And the mucosa is a dynamic structure just like our skin. And when we smoke, it makes the lining of the nose not work well. So we're not clearing mucus, we're keeping our congestion, we're keeping our viruses, thus we get sick more, and it does not help, and it is a definite problem.
So don't smoke, afronasal spray, no more than 3 days. Find that generic Flonase, fluticasone, couple puffs. Again, not all sinuses require antibiotics. If you have chronic rhinosinusitis, good idea to reach out to your local ENT. You just saw a sinus exam. Dr. Petersen does this right here in his office, can look into the sinuses and can better navigate rhinosinusitis. Again, we've been talking to Dr. Petersen. We've been talking about, hey doc, I have sinuses. So Dr. Petersen, again, thank you so much for coming to Doc Talk. And we're going to be back here again for some more episodes. But until then, I'm Dr. Paul Conley. Until next time, have a good night.